I was sitting in a school meeting with a parent and their mother, and the grandchild was the one who was struggling now. And the teacher and the principal was trying to explain to the parent, yes, we're going to hold her back. She just doesn't have the skills yet. And there's common misinformation of, well, it hasn't clicked yet. And, the misperception of and the misinformation, again, that doing the same thing for another year is going to really help. And the principal, out of genuine concern and based on her past experience, said to the mom, your daughter might cry for a week or two about being retained, but then she's going to forget about it and get settled in and it'll be just fine. And I could see the mother's face flushing, getting redder while the principal was talking, and the mother became very quiet, just almost stopped talking. And when we left the meeting, tears just streamed from the mother's eyes, and she said, I still remember the day I was told that I was being retained when I was in first grade. And so your comment about generational trauma, 100%. And this parent was just reliving that trauma experience again. And we almost describe, and I think it's accurately described it as, this is PTSD. This is PTSD of a different source, but it's an emotional charged situation with a really strong memory combining together, and it creates a huge emotional impact, and it just triggers the adult. And that's something we should not take lightly. It's not something kids easily get over with. Good evening, everyone. We're live on Dyslexia Discussions. We're live tonight to talk about dyslexia and mental health. And I'm going to start off just by saying I just came across that the Annals of Dyslexia 2024 actually has a whole issue of several articles just on dyslexia and mental health. And so we have our special guest, the clinical psychologist in the country of Trinidad and Tobago, Isolde Ali Ghent. And Isolde, welcome. It's a pleasure to have you with us this evening and talk about mental health, talk about trauma and learning difficulties.
Thank you so much for having me. It's my pleasure.
Absolutely. So for those of you who don't know, Isolde is a clinical psychologist in Trinidad who does a lot of private practice work for over 2 decades now. We won't age ourselves here. And has worked with the Morris Center of Trinidad and Tobago since it opened in 2016. Hard to believe, Isolde, we're now about 8 years into helping families and children in the country of Trinidad and Tobago, because we know learning difficulties are worldwide. It doesn't discriminate against geographic region or gender or socioeconomic status or anything else. It's just what it is. And so in those 8 years plus your few decades of experience, kind of give us your perspective on how you see trauma relating to learning difficulties. I know we're talking about dyslexia, but the trauma still affects dyscalculia, dysgraphia, any type of learning difficulties. The way I say it to parents is, if your child goes to school every day and all the kids around them can read and your child can't read, and the teachers feel like you should be learning to read now, and the child feels like I should be reading now, and they're not reading now, that's the actual recipe and design of a daily trauma. And it's not just a short-term trauma, it's traumatic every day, every class throughout the day. But share us your big picture on how you see trauma and learning difficulties.
I think over the years that I've been doing this work, both in testing and, in therapy, and I think what strikes me is the generational trauma when it comes to learning challenges regardless, and the coping strategies that have been handed down from parent to child throughout each generation, the pain that is inherited.
Yeah.
I would even say that, at a DNA level, and the coping strategies, whether they are healthy or unhealthy, modeled or just innate. Trauma, there's a generational trauma feel to it. There's also, without a doubt, experiential trauma, compounded trauma. But we also know, though, if we can intervene and help one child, then we can also help his or her parent and the next generation to come. So intervention is really, really, really important as soon as possible as well.
Yeah, I agree 100%. And Steven's here with us tonight as well, and he's experienced that personally. And let me just give one other perspective on this too. Is I was sitting in a school meeting with a parent and their mother, and the grandchild was the one who was struggling now. And the teacher and the principal is trying to explain to the parent, yes, we're going to hold her back. She just doesn't have the skills yet. And there's common misinformation of, well, it hasn't clicked yet. And, the misperception of and the misinformation, again, that doing the same thing for another year is going to really help. And the principal, out of genuine concern and based on her past experience, said to the mom, your daughter might cry for a week or two about being retained, but then she's going to forget about it and get settled in, and it'll be just fine. And I could see the mother's face flushing, getting redder while the principal was talking, and the mother became very quiet, just almost stopped talking. And when we left the meeting, tears just streamed from the mother's eyes, and she said, I still remember the day I was told that I was being retained when I was in first grade. And so your comment about generational trauma, 100%. And this parent was just reliving that trauma experience again. And we almost describe, and I think it's accurately described it as, this is PTSD. This is PTSD of a different source, but it's an emotional charged situation with a really strong memory combining together, and it creates a huge emotional impact, and it just triggers the adult. And that's something we should not take lightly. It's not something kids easily get over with.
It's a complex.
Sorry.
Yeah. No, it's complex. It's complex because, again, we have multi-generational trauma. We have the learning impact. We also have, so there's that kind of continuous, but then we also have an underlying attachment issue as well, which is where do we find our safety? How do we attach to others? Whether we have an anxious attachment or avoidant attachment. There are so many different layers to trauma when it comes to learning.
So you had that story, Dr. Conway, about the parent. I had that very same issue come up with my middle son in third grade. We were at a end of the year 504 meeting, and the two teachers, or his fifth grade teacher or third grade teachers, third grade teachers were in there. And the third grade teacher's like, well, we're going to retain him. I'm like, for what? And she goes, well, he's just not getting it. And I go, well, he has made straight A's all year long.
Wow.
And she goes, well, he's just not getting it. And I go, well, either he earned those grades or you gave him those grades. Which is it? And she got upset by that. And then she was like, well, if we're not going to retain him, we're going to send him to summer school. And that's the next statement that comes after, if the parent fights back and pushes back and says, we're not retaining him.
Right.
Well, we're going to send him to summer school. My question was, okay, well, who's going to be teaching summer school? The teacher said, I am. Which curriculum are you going to be using in said summer school? The same one we use during regular school. And I said, well, can you answer me, how many days was my son in your classroom last year? And she said, 180, whatever it was. And I said, and how many days is middle school or summer school? 2 weeks. I said, well, please explain to me, what are you going to teach them in 2 weeks that you couldn't teach them all year long with the same material and same instructor? I said, I'm not saying this to be ugly. Just help me understand that.
Yeah.
Because it doesn't make sense. And yes, the trauma of me going to summer school every year and fighting the retention every year is traumatic. And one of the things that put you in the at-risk category from Texas Education Agency is retention. And at risk means you're at risk of dropping out of high school.
Yeah, absolutely. There's even one statistic, Stephen, that says 60% of children who get retained do not finish high school. And one of our viewers, Anita Wallace, sums it all up, and exactly what we all agree with is more of the same thing is actually not a solution. And from the brain science perspective, the brain builds wiring, builds connections based on the experiences you give the brain. Whether we're talking about the experiences to learn how to read, or the experiences to learn how to deal with your emotions, or the experiences to learn how to do a sport, the experiences build the wiring. And so if you do the same thing, you should not expect new wiring, new skills, new abilities. But Isolde, let's come back to you and talk to us a little bit more about, your view of a model of trauma. Like, how is a way that you're conceptualizing trauma that we might explain it to parents to help them understand what that means? Because some parents have a hard time with that terminology. It's like no one's really physically hit the child or physically hurt the child, or they're not cut. Why do we use the word trauma to kind of describe that intense emotional experience?
Okay, thank you. So what I'm going to do is I'm just going to start with a very simple model. It's not mine. I saw it somewhere. No idea where I saw it. It stuck with me because it made sense. So pretend that my hand is a brain, and this is the brain stem, right? We all babies are born with brain stems. This is a very reactive part of it. We call it the reptilian part of the brain. You can see it right here on the slide at the bottom. So babies are born with this. The next part of then forgive me, Dr. Conway, for simplifying it this way, but this therapist understands it this way. So the next part of the brain that is developed then for our purposes is the limbic system. In therapy, what we call the feeling brain. That's our emotional center.
Yeah.
We have all of our emotions there. And in this this part of the brain, what they call the mammalian part of the brain, where there is some intellect but still highly reactive, is the amygdala, or what we call the worry brain. And that worry brain is that alarm system. That alarm system that says, hey, we're in danger, and it sends off these alarms that are really so loud and strong, they just hijack your brain. Because let's put it this way, we are meant to survive. Our brains want us to survive. Safety is number one. So our brain is looking out for danger. Right. So that's that part of the brain here, right? And so call this the worry brain, this the feeling brain, this is the reptilian part of the brain. And the most complex part of the brain, which you see up there, that frontal cortex, prefrontal cortex, is the most complex part of the brain that's developed thinking, problem solving, reasoning, filtering, and so on, right? So when we learn, we want to learn here through what we call the thinking brain. Right? So thinking brain, feeling brain, worry brain, and reptilian part of the brain. So these are very important parts of what I'm going to speak about right now.
Sure.
If you go into school every day, and every day you're experiencing this, I don't know what's going to happen to me, I'm not learning, I'm being criticized, I'm fearful, and this is happening to you day in and day out, what happens is that we always want, for instance, our thinking brain and our worry brain to be friends. That's why I like this example. See, they're friends because they're hugging. But if the worry brain is triggered and we flip our lid because we're just not learning, it's a really uncomfortable place to be, we are not feeling safe, our thinking brain goes offline and we lead with our feeling brain. So why is that so important? It means that we're not learning here, we're actually retaining here, and through another part of our brain called the hippocampus, which then stores that somatomemory, the visceral body cues associated, the symptoms then of PTSD, of trauma. Yes. So that if this is happening over and over and over again, then our brains are going to interpret school and other triggers, teachers, psychologists, as triggers, because there's something wrong with me. And then we react. So the amygdala, our worry brain, is going to say, avoid it, flight, fight, or freeze. Just pretend you don't see me, shut down, hide in the back. And then this pattern can go on and on and on. And so you have the brain, the calm brain that is ready to learn, that is open to ideas, that wants to test limits, that feels supported, that brain does well. But when our thinking brain goes offline, then so does our executive functioning.
Right.
Being able to manage these complex tasks, time management, starting, ending tasks, following through, right? Managing of our emotions, regulation of our feelings, all of that goes offline, right? And this is scientifically backed. You can see MRI scans. Right. When you look at the triggered brain, there's less brain activity in the prefrontal cortex, and the limbic system is lit up like Christmas.
So let me interrupt you real quick. Let's bring this back down to what does that look like in the classroom? I understand what you're saying, but you take little Johnny, little Sally, sit them in the classroom. You have your feeling brain and your learning brain going, and it flips its script like you were talking about.
It flips it, right. Flips its lid. So
right.
so little so
what
right.
does that look like for that child sitting in the classroom?
So that child's brain is looking for safety. Safety trumps learning. The child becomes hypervigilant, which means that there's no capacity, that the child is overloaded at that point. There's no capacity to learn or to integrate novel concepts coming in, because right there and then they're looking for escape or avoidance, or how do I not get called out, embarrassed? Right. How do I not, so school failure, poor grades, acting out behaviors. We call it the goals of misbehavior. Why do we misbehave, right? Yes. So to get a sense of power and control where we feel powerless, right? To avoid, to shut down, so better I don't try than fail, right? When we check out, which is that freeze, when we check out, then we don't have to experience that heightened level of discomfort and terror and fear. So that child then, yeah.
Yeah, and I think part of the challenge is that many children, adults, college kids with dyslexia will tell you when they had reading circle and they had to read and they were so anxious about what paragraph they're going to read, they're listening to nothing about what's being read. They're wholly focused on, where's my paragraph? Let's see, this one, I'm 6 paragraphs down, and they're spending all their time just trying to read to hopefully not look less intelligent, to not look less skilled, and like you said, to not be embarrassed by their struggle to read out loud. And your comment about just the frontal lobes, which one way I explained it to parents is like the brain is an orchestra, and here's the conductor. The conductor is really controlling all the parts to get them to work together. And when anxiety or worry goes too high, then the frontal lobe just kind of shuts down. And you're right. Now you're just in a state of anxiety. And so like Stephen asked, what does that look like? The teachers will see the students that some of them actually are sweating. They're sweating in the class because they're so panicked about what's going to happen, or they're worried they're going to be called on. Because remember, dyslexia has 3 diagnostic criteria. It's poor reading accuracy or poor reading fluency, speed, but it can also be poor reading comprehension. And many students who have poor reading comprehension may also have poor listening comprehension. So they're struggling so hard just to understand what's being described, discussed. That can be another point of that anxiety or that worry, or another factor of what is more traumatizing about being in the classroom.
But circling back to that point, when and I'm bringing it back to PTSD, when we're looking at the criteria then for PTSD, number one, we look at those intrusive thoughts. You have to have intrusive thoughts that are unwanted, they're sudden, they distract. So concentration is affected. And then, so if you're not concentrating and you're missing information, to your point, then how are you supposed to retain information that's said? So even though you might have dyslexia, mild, moderate, severe, sure. But then if you have the anxiety on top of it or the trauma on top of it, it will exacerbate those existing problems because of the concentration. And then, of course, at night, you're trying to go to sleep, and all of these worry brain thoughts. I mean, the worry brain loves to wake up at night, loves to wake up and keep us up. And then they circle and they circle, and there's that rumination, then there's sleep disturbance. So then you're fatigued, and then you're distracted. So then you have memory problems, and there's your vicious cycle.
Yes.
Well, you're also, parents are going to, they'll understand when I say this. So you think about your child, and you're talking about the worry brain that stays up all night. Your kid knows that they hadn't done their homework, or they have a spelling test the next day, and they're laying in their bed when they're supposed to be asleep, worried that they're going to fail, worried that they are going to look, poor in front of the rest of the class, worried about what their parents are going to think. And then they are so hard to get up the next morning. And what does that do? That starts a ginormous fight before they go to school. And now they're going to school hungry, possibly it had spankings and whatever else because they wouldn't get dressed in time enough to do it. And then you expect them to go to school and perform and learn and everything else. So they can't, because now they're tired, they're hungry, they're upset because of the fight that morning. And then they didn't actually get to study anything because they were so worried about not being able to. And it is such a vicious cycle. I vividly remember that as a child.
Yeah. And
one other thing I would like for you to talk about is I like to explain to people that, when you start talking about the fight or flight, when you're being asked to do something that you at that point in time physically can't do, and you're put in an environment that is very, what we're talking about, dangerous to you, that is physical pain. It's associated with physical pain. It's the same thing if somebody walked up to you every time that you were getting ready to read and just punched you. At some point in time, you're not going to want to read anymore, right? So it is connected to physical. It's the same thing to me as physical pain.
Sure. And we know that there are, and so circling to your point and circling back to how is trauma perceived, we get the symptoms of trauma before we get the narrative, because the narrative is formed in the prefrontal cortex. The symptoms, that visceral body experience of trauma, that is imprinted in the limbic system, in the feeling brain. So that pain, just you could be in the class and someone says, Stephen, and then all of a sudden you're triggered because your body just feels it. When a teacher calls your name, that means we're in trouble. And right away you're triggered. Prefrontal cortex has gone off and you're like, what? And then the teacher's, well, I know I just need you to pick up something just fell on the floor. But then you panicked because your body has learned to just react because you don't know what's coming at you. That fear of the unknown. The brain wants to survive, and school is something you have to survive. So we talked about fight, we talked about flight, we talked about freeze, right? Those are the three, but the attachment style is also something that is born out of that. So there's that, what some people call fawn, or wanting to please the teacher, even though really the teacher could be the trigger, or even though the teacher hasn't done anything, maybe they have. Wanting to please, or that anxious attachment where I need you, I can't be without you. It affects friendships, it affects social, who you choose to be around. I'm not going to be around these kids or the sporty kids or the bright kids or let me just go ahead and be around those who really don't care or underachieve, because you know what, at least we could be there together, because at the end of the day, we want our pack.
Yeah.
So.
And Stephen, think back to your experiences. Is there one particular experience, and let me just spell out this acronym. We're saying this PTSD. It's post-traumatic stress disorder. It means that something happened to you that impacted you so much with a heightened level of emotion and a heightened level of physiological perception as well, that memory gets so locked in that it keeps reoccurring. It keeps coming back. And like Isolde's saying, from speaking from the clinical psychology perspective, it can be triggered again later. And like that mother I described at the very beginning who started to flush, and you could tell she was having a physiological response to the principal saying that her daughter would forget being retained, when this mother knew that she herself never forgot, how that traumatized her and made her feel less than. But give us something that you experienced, because you lived this and you went through this, not knowing what was happening, not knowing why it was such a struggle, and knowing that you're putting all your effort into it.
So there's a couple different things. One that popped into my mind I'd say recently, when my kids were in elementary school, they went to the same elementary school that I went to.
And how was it the first time you walked in there?
So I hadn't been in there forever, and I'm feeling goosebumps just pop up over me, because I'm not even there, and I can feel what I was feeling there. It was so, and Isolde, you talked about the attachment, but people don't realize there can be attachment to a physical thing, place, doorway, cafeteria, classroom, whatever. And as a grown man, I'm a big man. I'm not somebody that gets scared easily, and I walk through this cafeteria or walk through the hallway, and I'm like, why am I feeling like this? I don't get this. I feel like I'm getting ready to be under attack, and I can instantly go back and bring myself back to as a 45 plus year old man. I can take myself back to and put myself in a third grader because of the trauma that was associated with that actual school.
Yeah.
And that's what I really want people to start understanding, why this is so important, to not we'll just continue to see what works. We'll just keep pushing them in that direction. Doesn't matter. I'm not really going to listen to the child. I'm going to listen more to the teachers, because they know you got to ask all the questions. You have to make sure that your child is being provided the most appropriate remediation possible, that has been tested at the highest level possible, and that it is actually working.
Yeah.
Because what you're doing is you're saving your child from all of that anxiety and PTSD
and trauma.
Yeah. And you're also saving them from giving it to their kids.
Yeah. Oh, yeah.
And
because 3 generations are saved. 3 generations are saved with intervention, the present, the one before, and the one to come. 3 generations.
Yeah. And this is why it's so important that it's not fair to our teachers. We give physicians thoroughly tested and thoroughly vetted medications to make sure they know what's going to be the most successful thing for whatever they're trying to help the patient with. It is completely shocking that we don't want to do the same thing for our teachers. We don't want to give them programs that have been highly tested, highly vetted, and have the highest chance of being the most successful for most kids. People like to say these nonsense statements like, well, no one program helps all kids. Well, but some help them more than 90%. Some have been shown to be more than 97% successful. We're only going to miss about 3% of kids. Why would we not want to give teachers these programs that are highly successful? Because otherwise, what we're doing to the students is every classroom in every school across America, and pretty much international for that matter, if we're asking teachers just to figure it out, that means the child is the guinea pig again, and a guinea pig again next year, and a guinea pig. And that means we're risking putting the child at a situation where they don't make successful growth. They don't become fully empowered with literacy. And we know that happens to more than 60% of children across the United States, and has been happening for more than 50 years. So we know that the number one way to prevent trauma from learning disabilities is an evidence-based, randomized controlled trial tested program in a way that then the child doesn't fall behind. But Isolde, talk to us a little bit about the treatment side, because in a More Center clinic, we're doing these interventions, but we're also trying to repair the self-esteem. We're also trying to repair and build some coping skills. And as you would say, from a psychology perspective, you're trying to help them process the emotions of what had happened, to desensitize them to what Stephen's describing as these trauma triggers. Talk a little bit about the psychological approach from trying to help process or treat or improve a child's ability to get past the trauma.
So there are a few avenues to that. The first thing is that we have to establish safety.
Yeah.
For so long, especially depending on the age, day in, day out, going in, and we're talking about school, but then the chastising at home. We have to, for some, they really get it live at home, as well. The criticism.
Let me jump in and just say, and Stephen and his mother did a show together on his Empowered Dyslexia podcast, where they talked about how, untreated learning difficulties basically stole a lot of their family's joy. It stole a lot of Stephen's childhood, because the family was so embroiled in conflict all the time, and he was feeling so bad about himself all the time because he wasn't pleasing his parents. It just creates this vicious cycle, just like what Amy Gleth-Roland mentioned too, one of our other viewers, saying, yeah, it's just a vicious cycle when it just keeps happening again and again. Sorry, Stephen, you're muted.
What a lot of people don't realize, yes, you're 100% right, Dr. Conway. When you have a student with a dyslexia, when you have a child with dyslexia, everybody that actually touches that child's life, that deals with that child on a daily basis, will be affected by that child's dyslexia.
Mm-hmm.
And people are like, what do you mean? That can't be the case, because there's only three classifications or requirements to be dyslexic, right? Why would it be anything else? Well, that's the psychological piece of it, because, Isolde, you had actually brought up the fact that the kids don't have a safe place. Well, if I go to school and I can't perform in school, and I'm getting in trouble in school, and then I come home and I'm in trouble at home because I was trouble at school, and I never have that place of safety or reprieve from my disability, and it's constant, and it constantly causes fights between, like in my case, it was a constant fight between me and my mom. And then I started understanding, well, if I cause a big enough issue, my dad will come in here, and then I can start a fight between them two. And then they're going to get mad and tell me to go away. And then they're going to go to their respective corners because they're mad at each other. And then, the last person that really was affected was my sister. My sister was not dyslexic. She actually graduated early because she's so smart. But she was not given the support and help that she needed as a growing child, as a teenager, the guidance that she needed. Why? Because my parents were putting every waking hour that they could into me, just trying to get me through school, trying to get me to survive. However, at what cost? At the cost of their marriage, and the cost of my sister's, growth.
Mm-hmm.
And that's just not fair to anybody involved.
Exactly. So it creates this sense of just not being safe, which is why oftentimes the child is living triggered, because so intervention has to start with establishing safety. How do we establish safety? Through structure, through unconditional acceptance, through words of affirmation, catching them being successful, holding up the mirror so that they see their successes. And because that's self-doubt. I'm afraid to ask for help because then I look bad. I'm afraid to raise my hand. I'm afraid to even answer because I'm going to look bad. So I might daydream or check out. Once we establish that routine, we establish that structure, we establish safety, and in the More centers, all staff instructors, occupational therapists, anybody who works with the student, we all use the same language so that there is a consistency, and we teach the language to the parents.
Yes.
So a different way of speaking, a more empowered way. So instead of encouraging or facilitating negative rumination, we challenge that worry brain. So we challenge the parents' worry brain, and we edge. So a lot of what we do is a lot of parent education, and that is important to almost undo some of the damage that's been done and teach new coping strategies that can replace those old fallback reactive type coping strategies. So that's one way. We also teach them to cue into their body cues. My heart's racing, my tummy hurts, my head hurts. What am I feeling? What sorts of thoughts are coming? Well, if I challenge my thoughts, I get new feelings, then I'll have different actions. So flavors of cognitive behavioral therapy or DBT dialectical in there as well. We sometimes a person may be so acutely triggered that there's word loss, word retrieval, because again, that we flipped our lids, prefrontal cortex is offline, word retrieval is like near impossible at that point. So we teach them how to express through art. So sometimes we use art. Always use mindfulness. Mindfulness practices, that's the practice of awareness. So being able to ground, be in the present, so that the worry brain isn't hijacking you, ruminating on the past, future tripping, so that you're there, and then you can see what your options are. And the reality is at that point that you're not in the danger that your amygdala, your worry brain, is telling you that you're doing. So it's a lot. We do a lot.
So one of the things that's interesting about what you just said about the prefrontal cortex shutting down when you're in that stressful environment, and your words retrieval is shut down. So now think about people who get angry really quickly and just go straight to yelling. Well, you're like, well, why are you yelling? Why do you just constantly yell? Because that's their brain has shut down, and that's the only thing that can come out of their mouth. So now we take this back to little Johnny, little Sally, whatever, sitting in the classroom. And why is their behaviors such like that? Why are they constantly on edge and ready to scream and yell and act out?
Right,
Their brain
exactly.
is physically shut down and can't do it.
Yeah.
That's right. So that's where we circle back to, okay, what are the goals of misbehavior? I think I mentioned that a little bit earlier on, whether it's for power and control, or to avoid, or to react, or to challenge, or to ask for help. I mean, there's several goals behind misbehavior, and those of us who are working with or adults, parents, caregivers, it's our duty of care to figure out what are the messages being sent to us. And even if we are triggered and our prefrontal cortex is offline, there's always a part of the brain that is online, and that is the observation brain. And that part of our brain allows us to cue into what's my heart telling me, what's my tummy telling me, what are my fists telling me, to be able to tune into your sensory experience at the time, and then use those systems to be able to ground you in the here and now, such as, as therapists, we use several grounding activities, such as colors, where you identify colors around the room, or shapes, or just things you can touch, smell, see. So there are different sorts of strategies we also teach. When I recognize that I'm triggered because my heart's racing, I'm breathing fast, I feel dizzy, I can do these techniques, my breath work, my counting work, and so many different strategies as well, because the observation brain is always accessible.
Is there an amount of time associated with that triggering, that fight or flight response, that it typically takes them 30 minutes, 45 minutes, an hour, whatever, to come back to a state of normal, to be ready to do whatever, learn activities, whatever? Is there I'm asking, is there just an average time that it causes, or that we're going to say that your brain resets and puts you back in a place where you can participate?
Good question. Really good question. And honestly, no. For me, it depends. My experience is that it depends on the environment.
Yeah.
If you're in an environment that's conducive to, here's a safe space, let's go, let's calm, and you're in a classroom that allows for it, versus being in a classroom where you have a very stern individual with people around you who are teasing you, and then you go home and you're going home to a hostile environment, there will be a difference if you even manage to, because some people just live triggered all the time. I've had folks in my office who are teary, who are, very, very triggered, but they would attune to my voice.
Mm-hmm.
So if I said, close your eyes, vision this, vision, they can be guided by my voice, and they will come down pretty quickly. If I would say, okay, look around the room, find 3 things that are red, go touch them. 3 things that are blue, go touch them. 3 things that are green, go touch them. And then they stop and they're laughing. I'm like, well, there you are.
And that's
Lost you for a minute.
Beautiful example is sort of like redirecting them away from the anger, away from the anxiety, and getting the brain just to focus on something else. And many people don't understand that one piece of occupational therapy is when it's done from a sensory integration methodological approach. And that means it's like developmental approach to OT is helping students better identify what's their current emotional state, or their interoceptiveness, they call it, which is what's your energy level, what's your emotional level, what's your toileting needs, what's your hunger needs, just where are you at in that internal body space at this point in time. And then there's other things in addition to the psychological therapies and the cognitive behavioral therapies that parents can be coached to do, which is some kids will calm down with a big hug because deep pressure can cause a stress release and a reset. Other kids want to do something activity. They want to go swing on a swing, and just the vestibular input of swinging on the swing can help them have a emotional reset and get back to a more calm state. That's a more ready learning state. And so it's really understanding all those different modalities of what we can do to help get that brain more calm, more, in a ready learning state, or a better learning state, and then be able to work on and engage back in learning activities. And many really adept teachers are really picking up on the body cues, or the tone of voice cues, or the intense look on the child's face cues, and realizing this child's kind of entering an anxiety state. This child's kind of entering an anger state. How do I help this child kind of stay on target, stay in that just right, ready learning state, and keep being engaged in the classroom? And I think that's what's really helpful about this kind of discussion today. And I want to switch back to one other piece and one other question is to say, so what can a parent do? When they've got a child who's more easily triggered, because Stephen's question is there a timeline, for how long it takes to reset? And the answer is yes, there is. And it varies from every child, and it varies for every teenager, and it varies for every adult, because there's multiple factors that affect how long it takes you to reset. But becoming aware of it as a parent to see it, then what are some things that you typically coach parents to do that they can do to help reset the anger or the anxiety or the frustrations?
The first thing that I always suggest is check in with yourself first.
Nice.
Because so many times our kiddos feed right off of us. We're anxious, they're anxious too. They mirror us. It's a reflex. So the first thing that we do, check in with ourselves. Where am I? Am I at that nice little optimal level of calm? Am I hyper or hypo? Do I have the energy? Am I irritable? Am I modeling? Where's this coming from? So that's the first thing. Sometimes it means just stopping what you're doing. And as you said, sometimes a hug, but even that can be overwhelming for a child who is triggered. So it depends. If there is a very, very high level of emotional reactivity, stop, allow for a nice calm space. Drink some water, take a shower, maybe even take a nap if you need to, and then process when things are calm. When things are calm, let's draw together. Sometimes just playing a game of cards, coloring something together, and the conversation just organically unfolds, naturally unfolds. Let's go outside, maybe do something physical.
Yeah.
But you have to be present. You have to say, you are in a terrible state, you go outside and run. What is that? That's not a great message to be sent, as opposed to, things are getting intense. Let's go outside and play some, pickleball.
Yeah. Or go for a walk.
For a walk. Let's go for a swim or do something, and I'll do this with you. I walk with you, next to you, and support you.
Yeah.
And just listen, not listen with the intention of answering, but truly listen with your eyes, not just your ears.
Right.
Listen with your eyes. Make sure that you are really, really present so that you're picking up on what the mouth is not saying. I'm fine. Everything's great. All of those cues. And we don't necessarily have to fix it, but be more present and offer options and allow them to talk, but let it happen under calm, because if we yell at them and they're triggered, that's only going to make things so much worse. So it's important that we tune into ourselves.
Can I add something to that? So we were talking earlier about children who have PTSD, fight or flight response. Something that, again, I'm not a psychologist, I'm not a neuroscientist, I'm just dad, right? And I just lived experience here. But what I've noticed and I believe is true, these children, those of us that have ADHD and that have that fight or live in that state of fight or flight constantly, we tend to pick up on social cues a lot quicker. We see that unspoken word, your facial expressions, your body movements, your this, that. And that's why it's so important, like what you were saying, is remove yourself from that stressful environment, calm down, even if you have to come back to it and talk about it later, because that child has already seen that you're upset, but long before your verbal attack came out of your mouth. So understanding that they are more sensitive to your behaviors than probably what you understand. And that's the reason why we have to make sure that we are going out and we're modeling that behavior of, hey, I know you're upset. I'm upset. However, let's take a break. Let's go outside, figure it out, go do something that has nothing associated with what you were dealing with. And then we'll have a discussion about this later.
Exactly. And that discussion can take the form of in so many ways, and just let it happen. There's no, you and your child have such a unique bond and just beautiful energy. You know what it is in your belly and in your heart. When the worry brain is triggered, however, we have a hard time retrieving those memories or really thinking rationally, because we're thinking through our feeling brain. So it's really important to make sure that our thinking brain is online, especially before we perform any kind of intervention.
And Isolde, I didn't ask you this in preparation, so you may not have one off the top of your head, but is there a good book reference that you direct many families to read about, to better understand and think about the emotional impact? And if you have one, great. If not, we'll post it in the comments later on. But I wanted to give you a chance to mention that. And then we got about 3-4 minutes left. I wanted to go and help show people this is not a minimal or small amount of kids that have this kind of trauma experience. I've got 3 different research articles we're going to pull up and show you the titles. And I believe all 3 of them are available free online. So parents can pull these down and read them to some degree too, to understand just how common it is that kids with learning difficulties are experiencing anxiety, worry, and true trauma from their chronic failures in the classroom. But first, to you, Isolde, thoughts on a book or a reading reference or a website that families can go to, or should we put that in the comments later on?
I do have it, and I think that when I do recommend books, it depends also on what's come up in the evaluation, things like late lost or unprepared, to understand what executive functioning looks like. Of course, all the Hallowell books on ADHD, as you would always say, Chad, is a great resource as well. And
Dr. Amon, he has a book called, that was just amazing to me, which was ADD in Intimate Relationships. And he talks about ADHD from many different vantage points. So one of the, your spouse has ADHD, you don't, and the communication that goes on there. The parents don't have ADHD, the child does. How do you deal with it? And, he just takes the entire family dynamic and then talks about it. What does it look like from each person's perspective, and how do you deal with that? When I read that, after I read that book, I was like, wow, now that answers so many questions about why me and my father fought like cats and dogs. Just sitting there listening to it, I was just like, this is amazing.
And I think that even understanding for parents and understanding themselves, especially when there has been grief, there's been trauma, and there has been that prolonged grief as well. I'm Okay, You're Okay is another great book as well, to understand the process of grieving and how it can affect, and really how to put boundaries on people, ourselves, how to put boundaries within. So those it really would depend on what comes up. But yeah, there's some great resources out there.
Well, let's pull up these last 3 articles. I went ahead and put the links in the comments here as well. But we look at these 3 articles, we can see this one here is on developmental dyslexia, emotional impact and consequences. And this is from Dr. Livingston in 2018. And they list what are the most common emotional experiences. And they talk about heightened anxiety, increased depression, increased worry, higher risk for suicide. Then there's another one that's also another recap on emotions and understanding mental health of dyslexia. And this is more of a broad review. They're trying to do more of a large scale review. This one's from 2023. I'm also available online for folks to read more about, understand more about the impact of trauma on learning. And then the last one actually is a whole issue of the Annals of Dyslexia. And it just came out in 2024. And this issue of the Annals of Dyslexia has multiple articles in it talking about dyslexia and mental health problems. And this is just the introductory section to say, we see this as such a big piece of the proper care and treatment of learning difficulties that the Annals of Dyslexia dedicated a whole journal issue to it, with multiple articles about helping people understand what the implications are if we don't get highly effective evidence-based treatments to children as early as possible and as young as possible. And I'll end with one really powering comment to say, and we also have studies that show how to prevent dyslexia's reading difficulties. My colleagues and I did a 5-year randomized controlled trial study and showed that we could identify kids at age 4 and 5 who are high risk for dyslexia. We could intervene at age 5, and more than 91% of them would not go to special ed. More than 91% of them would have fully functional reading accuracy, reading fluency, reading comprehension skills, and they've avoided special ed, and we've helped avoid all these trauma experiences. So as people are looking more and more for screeners and more for identifying when dyslexia has shown up, that's one piece of the puzzle. But the other piece is, but what do you do about it when you find it? Or how do you actually even prevent that it can happen? So, last comments, to give you guys both a second to think about what's your last wrap up for families here. We've had a great discussion about trauma and dyslexia, or all learning disabilities for that matter, and the worry brain, the feeling brain, and the thinking brain. And Isolde Ali Ghent has shared with us as a clinical psychology perspective and decades of experience helping work through the psychotherapy piece of this, and also as part of a transdisciplinary team at a Morris Center clinic in Trinidad and Tobago. And Stephen's talked to us about it from the personal experience, having lived some of this and having had to experience some of the trauma, and how even as a 40-something-year-old walking back into your old elementary school and your body's just flushed with this emotional experience because it's just so raw when it sticks. Isolde, last comments on the way we wrap this up?
It's huge. we've covered a lot. We've covered a lot, and as much as there is science-backed evidence to the way the brain processes trauma and how it may manifest and so on, there's also a very personal journey with trauma, and it's unique to each person. So even though we can we can say, okay, well, we look for these symptoms, we try this, we just have to remember to honor the spirit and honor the individual and their journeys thus far. We companion and we walk next to, and we meet them at their level, and be the team that we need to be.
Well said. Stephen, as the adult who went through it personally and then remarkably experienced the impact of true remediation, let's close the gap remediation, where now you're independent in spelling, you're independent in reading, and you already had very articulate speaking skills, but you now have experience that's even stronger now because it's more easy to find the words and formulate the words. What would you give your final take-home message to our viewers and those who will watch this as a recorded presentation?
I love that Isolde really used the terminology that this is a path, or this is a journey. I always in my mind's eye, I always picture this really long road. We actually made a graphic out of this saying dyslexia is a long, hard road, but you don't have to do it alone. I'll walk with you.
Mm-hmm. Mm-hmm.
So what I want parents to understand is, I'm going to get choked up here. What I want parents to understand is you're not at this alone. Dyslexia is this long, dark tunnel, and you're not going to get out of this unscathed. You're going to have some scrapes and bumps and bruises and whatever, but it is our responsibility, those of us that have made it to the other side. It's our responsibility to go back into that dark tunnel and grab as many hands as possible and walk along with them at their pace. Meet them where they're at is not just a buzzword. It is really what you have to do. You touched on it so perfectly, which is listen to them with the intent of not answering, but just listening to what they're saying. These people need to be heard to start the healing process. Your kids need to be heard. You as a parent needs to be heard. Because let's face it, our kids don't come to us with an instruction booklet.
Yeah.
And especially when your kids have learning disabilities. We're all out here doing the best that we can. That's where it's our job, our responsibility to bring the most relevant information forward so that you can make the most educated decision, informed decision about what you and your family needs as far as resources, help, remediation. And the faster that we do this, and I tell people this all the time, you are literally saving lives.
Yeah.
Your job as a parent, your job as a teacher, your job as an advocate is as important as any ER doctor, trauma doctor, because you're literally saving lives.
Sure thing.
100%, Stephen. I think it's a great ending point. Thank you both for taking the time to talk this through with us, share the personal experiences, the professional knowledge, and we look forward to having another conversation. Next week, we'll be doing a dyslexia success story, and then every other week, we'll get back on with another Dyslexia Discussions and More podcast. Thank you both. Have a great evening, and we'll share more information and keep helping kids succeed.
Thank you.
Bye-bye.